The seminal vesicles, prostate glands, and the bulbourethral gland is included in the category of the accessory glands of the male pelvis organs. In this section, we'll be studying in detail about the seminal vesicles in detail, the ejaculatory ducts, the prostate glands, prostatic urethra, and the bulbourethral glands in detail. So first we have is the seminal vesicles. So here is the location of the seminal vesicle. Now, they are the paired elongated glands. They are also named as the glands. They are the paired glands, elongated glands. They are located posterior and inferior to the bladder. So the location of these seminal vesicles is posterior, just posterior, and if you can see here, they're present inferior and just posterior to the bladder. And they're going to be secreting 60% of the semen, and the remaining 25% is being released by the prostate gland. Then comes the ejaculatory duct. Then we have, you can see in this picture very clearly that these are the ejaculatory duct, and this is the prostatic gland. Now, the ejaculatory ducts are formed by the union of lower end of the vas deferens and the duct of the seminal vesicles. So these two structures, the structures are making the ejaculatory ducts. So we have the vas deferens. This is the vas deferens coming down. This is the ampulla of the vas deferens, and along with that we have the duct of the seminal vesicles. They unite together, they open up here into the urethra, and they are forming then the single duct formed here is named as the ejaculatory duct. Its length is almost about 2.5 centimeters. It's not that much long. We have two ejaculatory ducts that are opening into the prostatic urethra. This is the prostatic urethra on both sides of the seminal colliculus, and they drain the seminal fluid in the prostatic urethra. The reason or the function of these ejaculatory ducts is to secrete or drain the seminal fluid, the semen, into the prostatic urethra. So what we've studied about the ejaculatory duct is that they are formed by the union of two vessels, which is the vas deferens and the seminal vesicles. They are two in number, they are 2.5 in the length, and they are opening up into the prostatic urethra. The purpose of this ejaculatory duct is to secrete the semen into the prostatic urethra, and they're present on either sides of the seminal colliculus. Then comes the prostate gland. So this is the prostate gland. This complete region is the prostate gland. It is the largest male accessory gland. So in males, this is the largest accessory gland, and it is fibromuscular, formed of the fibromuscular glandular tissues, and it is in this shape, in the form of the walnut. Now it is located at the neck of the bladder. This is the urinary bladder, and at its neck we have this prostate gland. It is traversed by the prostatic urethra, and it secretes about 20 to 30% of the seminal fluid, and it has the conical shape or the shape of the walnut. So you can see ejaculatory ducts passing through this region. We have multiple zones of this prostatic glands. We have the central zone, this is the transitional zone, and this one is the interior zone, and this is the peripheral zone. So 4 zones of the prostatic glands are the central zone, the transitional, anterior, and the peripheral zones. Then this is located at the neck of the bladder, traversed by the prostatic urethra, and secreting 20 to 30% of the semen. Its shapes is in the form of a cone or in the form of the walnut. It has few surfaces. Now we have the base of the prostatic gland, which is present on the superior side. So we have the base which is attached to the neck of the urinary bladder. So this is the base that is present on the superior side, and it is attaching on the to the neck of the urinary bladder. Then it has the apex. You can see this is the apex. It is located inferiorly, and it rests on the urogenital diaphragm. Then it has 4 surfaces. We have the anterior surface, the posterior surface, and the 2 lateral surfaces. Then it secretes the enzymes with the functions that aids in activating the sperm motility and in the mucus degradation. So helping in the mucus degradation and activation of the sperm's motility. The capsule of this prostatic gland, we have two capsules internally. It has dense fibrous capsule surrounded by the fibrous prostatic sheath, and later it is continuous with the puboprostatic part of the levator ani muscle. And then we have the prostatic venous plexus between the prostatic capsule and the sheath. So this is the venous plexus. Prostatic venous plexus located here. So inside it we have the true capsule, and on the outer side we have the false capsule. So internally we have this dense fibrous capsule located here, surrounding by fibrous prostatic sheath, and then it is continuous with the puboprostatic part of levator ani muscles, which is the levator the muscles of this this pelvis region of the males. And then we have venous plexus located here between the prostatic capsule and the sheath of the prostatic gland. Talking about the relations, anteriorly we have the symphysis pubis. So this anterior to this pubic gland, the symphysis pubis is present. On the superior side we have the neck of the bladder and the posterior rectum, and inferiorly we have the urogenital diaphragm. On the either sides, that is on the laterally, we have the medial margins of the levator ani muscles. So we have four things present here. Anteriorly we have symphysis pubis, inferiorly we have the urogenital diaphragm. Talking about the superior surface, so we have the neck of the bladder and the rectum located here. On the either sides, on the lateral sides, we have the medial margins of the levator ani muscles. Then we have the prostatic urethra. So prostatic urethra is basically the structures seen on its posterior wall. This is the one of the structure which is seen on the posterior wall. So this is the prostatic urethra. Urethral crest, we can see the urethral crest, which is the longitudinal elevated ridge. We have the prostatic sinus, which is a groove on each side of the crest. We have the seminal colliculus. This is the seminal colliculus, you can see here, which is the rounded eminence and opens into the prostatic utricle. Then comes the prostatic utricle, which is basically the depression on the summit of the urethral crest. So four things that we can see here is the urethral crest, which is the longitudinal elevated ridge present here. This is the crest here, longitudinal elevated crest present here. Then comes the prostatic sinus, is basically the opening or the groove on either sides of this crest. So on the either sides we have the prostatic sinuses. The seminal colliculus are the rounded eminences and opening up into the prostatic utricle, and this utricle is the depression on the summit of the urethral crest. Then comes the bulbourethral gland. So this is very small and paired gland and located at the base of the penis and below to the prostatic gland. It secretes the alkaline mucus for neutralization of urinary acids, for the lubrication during the sexual arousement. So the purpose of these bulbourethral gland is to secrete a hormone, that is alkaline mucus, for neutralization of the acids. The urinary acids has to be neutralized by this alkaline mucus secreted from the bulbourethral gland, and the other purpose for them is to causing the lubrication during the sexual arousement. Causing the contraction during the ejaculation. Sympathetic function is to oppose to the parasympathetic control of the erection. So the erection is the phenomena or the process by the parasympathetic stimulation of the nerves. So then the sympathetic function comes, and that is opposite to that of the parasympathetic function, and causing the contraction during the ejaculation. So this was about section 4. Here we studied in detail about the accessory glands in detail. We studied about the seminal vesicles, about the prostatic gland, the bulbourethral gland, their functions and their locations in detail. I hope it is really clear to you now. Thank you for watching sqadia.com.